Good afternoon, everyone. Welcome. We are back in the Karpf Auditorium for this week's SOU, which we recently found out some people thought this stood for the State of the Union. This gave me a little bit of a laugh. I'm like, this is not the State of the Union, but we are updates. And so we will present details on the current condition of UK healthcare. This isn't a speech on our part. This is a conversation and really a time to capture those thoughts and questions you all have, which is why we added the Q&A session for those who are able to attend in person. And we appreciate you who've made the effort to be here this afternoon. So with that, let's get started. And I'll bring up Tim, and he'll get us rolling.
Thank you, sir. All right, good afternoon, everybody. So Chris and I are tag teaming for Gwen today. She is serving as the great aunt. Her niece is actually in the process of childbirth right now, so you are stuck with the two of us today. We appreciate y'all being here. But as Chris said, we want to start with our mission, y'all. We want to double down on why we exist and how we are doing our work. And so y'all have seen this slide before. You will see this slide again because we think it does such a good job of really grounding us in what we do. And so the first is advanced care. We exist to do the type of work that others cannot do in the Commonwealth. And so we believe this is our mission. This is what differentiates us. This is what sets us apart from others providing care in this region. The second is taking care of our people and our partners. Y'all probably know the University of Kentucky is over 30,000 employees. And so we are one of the largest employers, and we have got to do a good job of taking care of our own. And so we recognize that as a pillar of what we do. And then secondly, because of our role in the state, we are a partner to those across the Commonwealth. And so we want to ensure that we are doing a good job in that space as well, meeting other health systems really where they are. Because we are that advanced provider, we want to make sure that we're partnering well. And then third, serving as an academic is a distinction for us. We believe we are better because we have got a tripartite mission in terms of provision of clinical care, high quality clinical care, teaching the next generation, and providing research. And so these things really ground us in what we do. Have not changed, and we don't anticipate these changing. In the coming weeks and months, you will hear us talk about Strategy 2030. We are in the process of developing that now, but I really expect us to stay rooted in these core tenets as a health system. So, next slide. Thank you. So recognitions. We've got 3 of these today, and so if you'll indulge me, I'm going to read a little bit more than I normally do when I'm standing up here, but I want to make sure that the group kind of has the flavor of some of these that we've gotten in the last few weeks. So the first one is from a patient from the 10th floor, Pavilion A. I see Ms. Blanton sitting in the audience this morning. So this patient expressed that she received exceptional care throughout her stay, beginning with her arrival in the emergency department. She specifically mentioned the staff who cared for her while she spent the night in the hallway. As y'all know, we are very full. We'll talk about that more in just a second. As well as the staff member who delivered her meals and affectionately referred to her as Ladybug. I don't know about y'all, but I don't have any nicknames that are as creative as Ladybug. She stated that she and her family were blown away by the level of care that she received. She shared that she typically does not experience the same level of health care in her home community and expressed appreciation for the excellent care she received while here at Chandler. So shout out to the 10th floor here in Pavilion A. The second one is from a staff member, so somebody who knows us well, right? Somebody who is on the team, so to speak, whose son had to come to the pediatric ER. Shout out to Shayla from Child Life in the Peds ER. If anybody knows Shayla, please let her know. We were unexpectedly in here with Nolan, age 4. I've had a 4-year-old son before, so I know what that's like. Yesterday afternoon with a paint chip in his eye. Child Life was able to distract him enough to avoid sedation. They were able to get us in and out timely, and such an awesome effort for all the teams. If I didn't work here, I would have never known we were that busy. Such a calm and thoughtful team and atmosphere. That is awesome, y'all, in terms of helping out a 4-year-old in need, right? And then third, all physicians and nurses. A collective thank you to all of our physicians and nurses for the significant improvements in patient experience scores this month. The data are currently in the blue, which means exceeding target, reflecting the team's focused efforts to improve communication with patients and with families. So let's pause and recognize our teams. Well, good deal. We appreciate that. So I want to shift a little bit to our employee engagement survey results. So I'm going to talk for a few minutes, y'all. And y'all know I'm not good at standing behind this podium, but I'm going to do my best to stand here. And so I want to talk at a really high level. We're going to talk kind of industry-wide, and then we're going to zoom into UK healthcare. And what I want to say as I sort of jump into this is all of you will be, should be, and will be hearing more from your department heads about our results, right? And so, you know, these, while we certainly don't know who said what in these, we don't need to know that. What we are interested in is what are the drivers in each of our departments, and then how should our action plans meet the needs of our associates in individual departments. So first, at a macro level, nationwide, if you go back in the last 2 and 3 years, engagement scores overall have been slightly declining, okay, across healthcare, in particular, in health systems just like us. And what we're seeing nationally is kind of a bifurcation, right? So the higher performing health systems are getting better. Those that may be below average are dropping. And so the groups in the middle, the health systems in the middle, that percentage, that piece of the pie is growing, all right, is really what we're seeing nationwide. The variation across organizations is increasing. Okay, so that makes sense, right? As the top performers are improving, and those that are below average are dropping, the variation is widening. So the intent to stay is less stable. All right, so we've all heard of the gig economy, right? We are seeing that show up in American healthcare. And so those folks that are intending to stay with an organization for their entire career, those aren't around anymore. My dad finished school, stayed with one company his entire career. He's a good example of that, right? From soup to nuts, start to finish. Those folks, the percentage of those that make up the workforce is shrinking. And we are seeing that nationwide and certainly in healthcare. Consistency and clarity in how work gets done continue to differentiate stronger performing organizations. So I read that on purpose, y'all, because that gets to something we're going to talk about in a few minutes in terms of high reliability organizations. That gets to standard work. That gets to role clarity. That gets to a safety culture, okay? And so that is an important piece, I think, nationwide in American healthcare, and then certainly for us here at UK healthcare, okay? So consistency and clarity in how work gets done continue to differentiate high performers. Important piece there. And then engagement is increasingly influenced by how effectively organizations navigate change and complexity. I think it's safe to say we are going through quite a bit of change here at UK, right? There's a lot going on. And so we want to acknowledge that first and foremost, and we want to call out that we want to continue to excel in this space. We want to communicate in different venues and different media so that we are addressing questions and concerns from our teams. Does that make sense? Okay. So zooming in, talking about us a little bit. So as y'all will recall, we took the survey in September of 2025. Prior survey was in I believe it was the spring of 2023, if memory serves. And so over that time period, zooming out, UK healthcare writ large, we saw a 1/10 drop in score. We went from a 3.94 to a 3.84 score overall, okay? That's one of the few numbers I'm going to throw at you this morning, but that is, you know, one of the main ones. So from a percentile perspective, y'all, that puts us at about the 38th percentile compared to other academic health systems, okay? So a little bit below the 40th percentile compared to other academics. Our response rate was 63%. So just out of 6 of 10 of us took the survey, okay? So as we know, just like we know with patient experience and press scanning on the patient experience side, we aspire to drive that number higher. We believe we are better with more feedback, right, from our teams. We will come back to that theme in just a second. So understanding our engagement score, I feel like I belong in this organization. We scored pretty well there, y'all. That's something that people were grounded in here. I would like to be working at this organization 3 years from now is another area. We did pretty well there. Okay, we got some opportunity. And I should also mention, this is an area writ large for us. You know, I mentioned organizations nationally, the group in the middle, the neutral group, if you will, that's growing. We saw that also here at UK Healthcare. Okay, so that theme kind of runs through our results as well. Third, I would recommend this organization as a good place to work. We scored pretty well here. I would stay with this organization if offered a similar position elsewhere. We scored okay here, and then overall, I'm a satisfied employee. So when we look at the drivers, okay, there are a few things that drive this for us. These are not materially different than others across the country. Okay, these are common themes for us and for other healthcare providers. So I'm going to group these into 4 buckets. Okay, so baseline needs, organization, leadership, and safety culture, prevention, and reporting. All right, so I'm going to take each of these individually. So the first one, I am satisfied with the recognition I receive for doing a good job. So y'all, this is something that our teams have told us we got to do a better job of. Now, I believe personally the best way to improve is to own it and get on with it, right? And so that's what you're hearing from me this morning. We're going to talk about some things that we're not doing as well as we want to, y'all. And so I'm here to tell you, we want to own it and get on with it, okay? Now, the getting on with it part really speaks to our action plans that should be department by department, okay? But from recognition writ large, y'all, I am terribly interested in this group's thoughts and in your thoughts, both specifically to me and to your department heads, okay? So Chris, Gwen, and I are all committed to really improving what that looks like. And so we want to hear from you, both through our action planning process, and if you got specific ideas, certainly let us know what that is, because we want to ensure that we're celebrating the good work that we're doing here. So that's an area of opportunity for us. That second bucket is organization, right? So 3 specific areas that jumped out. So number 1, I have confidence in senior management's leadership. That stings, right? That stings. But part of improving is owning it and getting on with it, right? And so, as we've got opportunities to improve that, tell us what that looks like to you, right? Where are we not meeting the mark there? You know, specifically, what does that look like? The second, this organization conducts business in an ethical manner. I believe those are 2 sides to the same coin. Right? And so if we've got questions and concerns about that, obviously let me know where those are. I think, this is my perception, and may be wrong about this, that gets back to a lot of the change that's going on in our organization right now, right? The rapid pace of change that we've got. We are talking a lot about, you know, with Julie and team, you know, what's the next evolution of how we communicate about everything going on here? And so what are those different media? What are those different environments and ways we do that? What's the most effective ways to do that? And then thirdly, senior management provides a work climate that promotes patient safety. Again, that one stings, right? At the end of the day, patient safety and quality is the most important thing we do. Everything else is a means to that end, right? We have a moral imperative to take good care of our moms, our dads, our sons, our daughters, right? And so this is an area where we want to excel. Now, as we think about what are we doing about that, again, we're going to have action plans that you'll work with each of your department heads on. But from a macro level, y'all, that is why we are about to embark on an HRO journey. That is why. It will become the way in which we deliver high quality, consistent, safe care here at UK Healthcare. Third bucket, leadership. There's a climate of trust in this organization. Again, that one stings, right? But I think we've got to own it and get on with it. And so what does that look like? I think personally it begins by acknowledging where we're not doing as well as we want to do, which is why we're here today, right? And so I think, as we get into action planning, this is something that we'll need to talk through of how do we bridge that gap with our teams and across the board. Then the fourth bucket is safety culture, prevention, and reporting. And so specifically where I work, employees and management work together to ensure the safest possible working conditions. Again, this is back to a high reliability organization, right? Ensuring that every one of us knows what success looks like for us on any given shift at any given time. And so how we do that is, by standard work. It's by standard expectations. It's by having a reporting structure that allows us to report pebbles in the shoe is how I think of it. Now, those could be minor nuisances like my wow's not working today, or those could be major safety concerns that we've got to address culturally. And so for us, those are our main drivers. And so what it means for us going forward, y'all, we got to build on our strengths. I've told y'all this before. I'll tell you again. One of the things that our Joint Commission surveyor said to us back in April is your team understands why you exist. If that is not a compelling strength, I don't know what is. Our team is committed to the Commonwealth. We are committed to the health of the Commonwealth, and I'm grateful for that. I don't take that for granted. The second, be intentional about where we should improve, right? That starts by acknowledging where we need to improve. And then thirdly, focus on a few actions that will make a real difference. Y'all, we're not going to try and boil the ocean. I think that's a waste of time. What I do think we've got to do is take specific actionable steps to address, what our drivers are. And so for our leaders in the room, that is the ask. In our action plans, those are due at the end of May, we'll talk about that in just a second, we've got to be specific around what is it we are going to do to address our drivers. So for our leaders, engage our teams. For those in our departments that are watching this or here this morning, you should expect to hear from your leaders around creation of our action plans to ensure that they are meaningful for your departments and for your units. I want us to address the challenges that impact how work gets done, right? And so are we removing the pebbles in the shoe to effective operations? I'm going to take a second and brag on the Chandler OR. If you look at the Chandler OR's on-time starts, y'all, over the last 4 months, we are steadily ticking up. And we have done that through a team approach. We are removing pebbles in the shoe of our staff and of our surgeons, and we are seeing the improvement there, y'all. We were 86% on-time start yesterday in the Chandler operating room. That is phenomenal for an OR like ours. And that's our team's work of removing those pebbles, removing those barriers to effective work getting done. And so then for all of us, y'all, be part of the conversation. That's my ask of all of us, right? Have a voice in our action planning process. Share input, and then help create what this should look like going forward. So I have said a lot about that. We can certainly address more about that in questions if you'd like, but that is just a snapshot, a high-level overview of our employee engagement results. Again, you'll hear more about this in more detail from your department heads. Tied to this, y'all, and as a piece of this, as we're developing our teams, you'll hear more about this in the coming weeks. We are starting a book club if you are interested. And so the first book we're going to be talking about that on June the 17th, I think is the first time. It's called The 4 Disciplines of Execution. And so as we think about how we do the work, right, how we get consistency in what we're doing every day, that book is one that we're going to jump into as a group of leaders and associates across UK Healthcare. All right. Well, good deal. Chris, you want to come up and talk about immunizations?
Immunizations. So let's talk about them. We talk about being truthful. So communication went out to our physicians, staff, residents about immunizations. A little bit ambiguous, launched a lot of concerns. People weren't up to date in their vaccinations. A separate email came out to explain we are doing compliance with immunizations. So what's going on in the background? What's the why? The why is because employee health has a very old EHR. We had stuff in paper. We have asked them to incorporate it into Epic, which has its own module for employee health. And so we've been moving those records over. And so when we say you're non-compliant, we just might not have the records that you have obtained. Doesn't mean you didn't get your shots. It just means we don't have the documentation. Some people can't get the shots. That's fine. Explain that to employee health. So you will be getting an email if you are not in compliance. If you do not get the email, you are in compliance. Just that simple. So that's what we're sending out, and that's the why behind the immunizations, and trying to keep our workforce safe, making sure that we do not have these communicable diseases, and we're working our best to make sure our staff are vaccinated. All right, HRO. So in March 17 through 19, there were representatives from Press Ganey, that's the company we're using to roll out HRO, and they came to Lexington to meet with our teams, and they actually met with 470 team members representing various departments, participating in focus groups and rounding, and we want to thank everyone who took the time out to meet with them. From this input, they're compiling that all now. Press Ganey will come back and deliver those findings to the executive leadership and entity leaders, and that will be on April 27th, 2026. Following the presentations, results and key insights will be shared with leaders here, and then we expect them to share those with those teams. Also, in the next few weeks, the HRO leadership team will reach out to key leaders to solicit interest for those who want to do so in HRO subcommittees centering on implementation, communication, metrics, and so forth. And as a reminder, this is a multi-year process. We are in our first year, our first few months. This is phase one, with phase two on the horizon, which includes developing our HRO strategic roadmap over the next few months. We'll be rolling out more. So we'll continue to give you updates in this State of the Union, systems operations update. All right, we've heard a lot about emergency department numbers, and I understand our capacity challenges, live that every day, but we've had questions about the ED volume, so we want to share some details with you. The volume in the ED is increasing, and that is normal for this time of the year. January and February is inclement weather. Fewer people go out. That doesn't mean those that don't go out don't break something and come in, but by and large, the volume coming to the ED is lower. In March, it tends to spring up. And so we're seeing more patients in the ER, okay? Well, we also receive transfers from outside hospitals. The majority of patients who are admitted at UK Healthcare come through our ED because of the surrounding counties, because of Lexington and then the adjacent counties. The transfers are less of a volume, but absolutely necessary as we provide that complex care. All of that together with our admissions from clinic and our procedural admissions means we admit a lot of patients, and we're at 98% occupancy the majority of the time. We do not have extra beds hidden away. I wish we did, but we don't, which means that we have to be very efficient in what we do. We have to take care of the patient, and when they're ready for discharge, we need to move them out of the hospital so we can bring up other patients from the ED. None of us want boarding patients in the ED. None of us want to be that patient. So be cognizant when you're discharging on your floors, do it expeditiously, make sure the orders are put in, nudge the physicians, use the discharge lounge, because all of that means something to the patient boarding in a hallway. And that's what we want to do, is be efficient with our care. Now, we are going to post signs now in the ED, okay? The ED patient experience team has designated a chair area and a hallway to serve as additional treatment space. Information will be posted about these spaces, and the signage is really to allow patients to understand what's happening in our institution. And then I want to comment on the new mother-baby unit. This is a necessary opening of a unit. It's beautiful. We have capacity issues in OB as well. As an obstetrician, albeit a long time ago, delivered my fair share of babies, our volume has increased there. And we have boarding of laboring patients in non-laboring beds. I can't think of a worse experience for that patient. And so this unit allows for us to expand. Beautiful unit. I just toured it yesterday. 20 beds, newborn nursery, all the amenities. It's really a lovely floor, and I'm thrilled that we got that up and going. And then finally, a couple of general operations updates. So the next third Thursday is April 16th, next week. And we have decided to change the SOU to once a month. So our next one will be May 14th. And submit questions that you might have to the next SOU at corecom@uky.edu. And I will turn it over to Tim for some Q&A.
All right. Thank you, sir. So, y'all, one of the questions before we jump into that, really, it was from a couple weeks ago, and it dealt with spending. Is really what it boiled down to. And so, I'm gonna, if you'll go back to that, Michael. Yeah, here we go. Okay, so if you'll indulge me, I'm gonna read this just to make sure I kind of get the question. So, why does it seem that budgeting for sports is a higher priority than budgeting for proper and needed staffing in healthcare? Okay, so this was the question as it came in. And it occurred to us, we got to make sure we're doing a good job of telling the story, right, of why this is important. Why do we track our labor expenses? Okay, and so we've got a couple slides here that we're going to walk through that speak to that. Okay, so the first one is looking at total revenues across all of UK. Okay, and so y'all know I am in no way an expert on college athletics. I like to think I am, particularly around football season. But I am not. But I do want to highlight here, since FY16, this is a look at the revenues of the University of Kentucky, okay? And so the dark blue box you see at the bottom is the higher education portion of our business. Now this year, y'all probably remember us saying, we're gonna be about an $8.8 billion organization, okay? So you see we're 8.6 is what we're showing on the far right side, right? And so going back to FY16, we were 3.3, 3.4, somewhere in there. So tremendous growth in that time period, right? The dark gray is UK athletics, right? And so as a total percentage of revenue, relatively small compared to the higher education business and the healthcare business. And then look at the light gray. These are the UK healthcare hospitals, all right? So what jumps out to you there? Rapid growth, right? So this year, UK healthcare will be about a little less than 5.5, if memory serves, well, 5.1 is what we're showing here of the 8.6, okay? So around 60, 63%, somewhere in there, I forget the specific number, of total revenue of the University of Kentucky, okay? So if we can go to the next slide, please. Now, we want to break out how we spend our money, okay? So, y'all, this is no different than our checkbooks at home. A couple more commas than what we've got at our house, a couple more zeros, but the same philosophy, okay? And so we show here this blue color, 38% is on all of us. 38 cents of every dollar is on labor. It is our single largest expense, as you see. All right? So think about 38 cents of, what was it, 5.1 billion this year? 38% of that, right, is what we all are paid. I'll hit each of these quickly. 13% is facilities, equipment, utilities. 20% is drug cost. This number, y'all, is larger than most other health systems because we have such a robust pharmacy here, okay? Because that drug cost number is so high, it actually shrinks the percentage of the pie that we pay in labor, which is ultimately an amazing thing for us. We are doing fantastic by our patients across the Commonwealth. We have an incredibly robust pharmacy that's meeting the needs of patients really everywhere. And so that percentage helps make our labor percentage a little less, which is a great thing for us. College of Medicine clinical support, 16%. you heard us say at the outset, right? We are an academic health system. It is what makes us better. We believe that to our core. Part of that is supporting our partners in the College of Medicine. So 16 cents of every dollar that we generate here at UK Healthcare goes to the College of Medicine. Then you see med supplies are at 9%, and then purchase services are at 4%. And so when we think about how we spend our money, and when we answer the question, I'm paraphrasing, why do we need to watch our labor costs so closely? This is why. Because it is the biggest portion of what we spend here. And so as we are thinking about what are we doing to lead and operate a healthy health system every day, just like we all do in our homes, we've got to watch those largest expenses. And this is a little breakdown of how we do that. So we can talk about that if you've got additional questions about that as well. But I do want to open the floor for questions. I've got one other one that's jumped up about parking, for sure. This is always a hot topic that comes up, right? The question came in, it was around parking for the new Cancer and Advanced Ambulatory building. Where will parking be for that? And so the short version is we are working on that now. And so as y'all can see, coming out of the ground behind that building is a massive new parking structure. And so that is going to add capacity to our campus. And so as you would expect, we are looking holistically now, y'all, at the parking philosophies that we've got on our campus today. And so, is what we've done historically still the right thing for us going forward? And so we're partnering with our campus parking colleagues to do that. A part of this question was, will there be a pedestrian bridge built across Limestone? The answer to that is yes. And so, whether that informs parking or not, I don't know yet, but there will be a bridge across Limestone that connects Pavilion A to the new Cancer and Advanced Ambulatory building. So, as y'all would expect, we're looking at all of our bus routes, we're looking at where folks park and all of that in that regard. So, that was really the major question for today. So let me pause. Y'all have heard me talk a lot this morning. What kind of questions do we have? Yes, sir.
Well, first, I would like to take honor and appreciate where we gave recognition to the providers and nurses earlier in the presentation. But how come we didn't give recognition to ancillary groups as well?
Yep.
How come that seems to be left out?
Yeah, Wayne, that's a great point, y'all, and that's my failure. That is on me. Something I say all the time, and I missed it here clearly, is healthcare is a team sport, right? Y'all have heard me say I'm more of a football fan historically than basketball. If we lined up 11 wide receivers, we're going to lose every play. And so you're exactly right, Wayne. You're exactly right. So one of the benefits, one of the things I enjoy most about working in this, y'all, is we get to work with talented physicians, nurse practitioners, PAs, respiratory therapists, surgical scrub techs, nurses, dietary folks, our environmental services staff, our facilities team. That is what makes this work. I'll also say, if I don't come in here tomorrow, UK Healthcare continues. But if our environmental services team does not come in here tomorrow, we have major problems, folks. Major problems. So it's a fantastic call out. Thank you. Thank you. What else? Yes, sir.
I'd like to first appreciate our mission statement that you gave out earlier. And I have a scenario that I've dealt with recently, just a few days ago, that would contribute, the fact that would affect the outcome of our mission statement is, so I had, was scheduled in PACU, and I was helping RTs because we've been short in med-surg over in PAVH. So I did a patient's neb, and I come back to do the second neb on the patient, and I got called to PACU to set up a BiPAP on a patient. So I contacted the RT, and then told them that this patient's on a neb and we need to put, whenever the neb's done, take it, put it back on their trach collar. Well, there's an incident report because that RT got busy because they're already short-staffed in respiratory, which the downside is we have this immense priority for patient and nurse ratios, but not for ancillary staff. So this situation is causing, respiratory shorthanded. But, nurses, that ratio is not going to increase. We're going to get travelers to prevent that from happening. But would you not think that ancillary staff not being staffed appropriately would also affect patient outcomes as well, just like having short staffs on nurses?
Yeah, there's no doubt, y'all. And so something, kind of going back to the conversation about how we spend our dollars, right? So something that we do here pretty well, actually, is track our labor expense, okay? We have to do that. That is a kind of a fundamental expectation that we should all have of our leaders. That is true for our nursing teams. That is true for our respiratory therapy teams. That is true for every cost center within our health system. And y'all, we do a pretty good job of that. And so, how we staff those departments, I think, Wayne, you mentioned, do we supplement with agency staff or not? We make the decision to do that kind of based on most acute need. And so it might be that is a need in some of our areas. Could be central sterile, could be the OR, and not in other areas, given the makeup of our teams. So it's a balance, y'all, that we've got to look at kind of department by department. So, what else? What else comes to mind this Thursday? Wayne, let me catch you offline. We'll see if anybody else has got any questions. I won't keep the group. All right, y'all, listen, I appreciate you. We're grateful for you. We're thankful for what you do. Y'all go make it a great Thursday. Thank y'all for being here.